Good day, viewers. We're here to present the very interesting topic that says availability of infection control supplies in the primary and the tertiary government health facilities in Enugu State. I am, by way of introduction, Dr. Ajuba Miriam. I'm a consultant in the Department of Community Medicine, SU Teaching Hospital, and also a consultant in the hospital, SU Park Lane. And presenting with me on this interesting topic is
Dr. Hope Nwoga, also a consultant in the Department of Community Medicine, SU College of Medicine, Park Lane, Enugu. Both of us will be doing justice to this presentation, but she will take the first part of the presentation. When she's done, I'll come back for the rest of the presentation. Thank you.
Thank you. Okay, I am still Dr. Ajuba Miriam, and I want to introduce this topic by saying that the World Health Organization estimates that over 1.4 million people suffer from nosocomial infections, that is, hospital-acquired infections. And the proportion of these infections is about 20 times higher in the low and middle income countries. Most of these nosocomial infections can be prevented with readily available and inexpensive strategies like adhering to recommended infection control measures. Availability of infection control supplies has been seen as one of the things which, if is adequate, it can go a long way to affect the level of infection control in healthcare settings. So this study was designed to assess the availability of these infection control supplies in the primary and the tertiary government health facilities in Enugu State. Now, the methods that we deployed for this study was a comparative cross-sectional study that used both the qualitative and the qualitative approaches. A two-stage sampling technique was used to select 400 healthcare workers. We had to do 200 from the primary healthcare facilities and 200 from the tertiary health facilities. We used the quantitative data instrument, that's a questionnaire, a pre-tested self-administered questionnaire, formulated according to the CDC, that's the Center for Disease Control Prevention Guidelines on Infection Control. The qualitative approach, what we used was the in-depth interview guide that was conducted on 15 healthcare workers. The quantitative data was assessed using an SPSS version 22 software, and our significance level was less than 0.05. And for the qualitative approach, we had to do our analysis using the manual content method. At this point, I'll have to invite Dr. Hope, my colleague, to come in and speak on the results of our study. Thank you. Dr. Hope.
Okay, thank you, Dr. Ajuba, for the nice presentation. I'll take us on the results. Our results showed that availability of infection control supply in both the primary and tertiary health facilities were comparable. Least proportion of the respondents in both study groups had good infection control supplies. About 16% of the respondents reported good infection control supply in primary health facilities, while about 16.5% reported good infection control in the tertiary health facilities. The fair infection control supply was reported in about 34% of the primary healthcare workers and 33% of the tertiary healthcare workers, while about half of the respondents from both study groups reported poor infection control supply in their health facilities. The result of our in-depth interview also showed that majority of the healthcare workers reported affirmed poor infection control supplies in their health facilities, especially face shield or mask, hand washing facilities. However, hand gloves were the most commonly available and used personal protective equipment that we discovered from the study. Our conclusion is that the infection control supply was poor in both the primary and tertiary government health facilities in Enugu metropolis, and we recommend that institutional support in providing infection control supply in these health facilities should be stepped up. I think my colleagues should have something to say at this stage.
Oh yes, thank you very much, Dr. Hope. And again, setting up infection control committees in these facilities, these primary and tertiary health facilities, will go a long way to ensure that these infection control supplies are at least available. I think
Okay, our topic still remains availability of infection control supplies in primary and tertiary government health facilities in Enugu metropolis, Nigeria. I remain Dr. Hope Nwoga, and my colleague
Dr. Ajuba Miriam.
Thank you.